Hi everyone, good evening. So it is happy to see you all together. Rajesh, do you have any doubt?
Yes, sir.
Ah,
Sir, my relative is affected by myocardial infarction. Can you please explain me about this condition?
sure. Please. So what is this myocardial infarction? So it is a condition characterized by death of cardiac tissue due to disturbed or obstructed blood supply. Normally, if you find any person with this myocardial infarction, then their blood supply is disturbed. Okay, so this it is termed as myocardial infarction or acute myocardial infarction, or in common man they will tell heart attack. Okay, so let us see about this myocardial infarction. There are five types of this myocardial infarction. The first one, type 1, is due to the result of ischemia caused by primary coronary event. Okay, so there will be some blood supply will be affected and oxygen demand will be there. Then type 2, this is a secondary one caused by supply and demand mismatch. So there will be supply will be less and demand will be more. So there is a mismatch that will result in this type 2 myocardial infarction. Then type 3. This type results in sudden cardiac death. So third one will be there will be suddenly the heart will stop work. So it is a sudden cardiac death. And type 4, it is further characterized into 4A myocardial infarction associated with percutaneous coronary intervention. Type 4B myocardial infarction associated with the instant thrombosis. There will be in type 4 there will be thrombosis, that is blood clot will be there in that. Then type 5, this type is associated with coronary artery bypass surgery. Okay, so in this case they have to undergo a bypass surgery. So there are totally 5 types of this myocardial infarctions. So what are the causes for this myocardial infarctions? First one, ventricular hypertrophy, then hypoxia, coronary anomalies, then arteries and coronary arteries emboli. Okay, these are all the causes for this myocardial infarction. So, have you reported with any kind of sign and symptoms? Can you able to tell that one?
Uh, he having chest pain, sir.
Chest pain. Okay. So one of the sign and symptom will be that chest pain. Okay. So there will be a sudden chest pain. Then excessive sweating will be there. Then shortness of breath. So if you find a person with this problem, then immediately you can come to conclusion that they are having the myocardial infarction. Okay. Then there will be palpitation as well as anxiety. Okay, so what are the complications with this disease? That is abnormal heart rhythm. Okay, there will be usually you will find that one that normal heartbeat, but in this case there will be abnormal heart rhythm and there will be cardiac failure. Heart failure will be there. Then there will be rupture in heart cells. Then valve problem will be associated with this myocardial infarctions. So what kind of treatment we can give? So there will be, they are giving that nitroglycerin, ACE inhibitor, blood thinners, antiplatelet drugs, beta blockers, pain relievers and thrombolytics. These are all the drugs that are associated with the treatment of myocardial infarction. So one of the drug is aspirin. That is an antiplatelet drug. So it is commonly known as aspirin. Chemically it is known as acetyl salicylic acid. It is a non-steroidal anti-inflammatory drug, that is NSAID. So it carries the antiplatelet, antipyretic action and it is used for the treatment of myocardial infarction. You will find the structure of this aspirin. So benzene, it is attached to the carboxylic acid and acetyl derivative will be there. OCO-CH3, acetyl oxy group will be there. This is the structure of aspirin. And what is the mechanism of action of this aspirin? First, arachidonic acid, that will be catalyzed by the enzyme cyclooxygenase 1, then that will be converted to prostaglandin and which will be carried down to thromboxane A2, then which will lead to platelet aggregation. So here the aspirin, that is our drug, that will act on this cyclooxygenase enzyme. In short, it is known as COX. So this aspirin will act on this COX enzyme and it will produce its action. How will you synthesize this aspirin? So first step is we are taking with the benzene and sulfonation, it will be converted into benzene sulfonic acid, followed by treatment with the sodium hydroxide. So sodium phenoxide will be formed. This sodium phenoxide under the treatment of carbon dioxide, high pressure, temperature and hydrochloric acid, it will be converted into salicylic acid. OH, COOH will be formed. This is followed by the acetic anhydride. This salicylic acid on treatment with the acetic anhydride, it will give the compound aspirin. This is the synthesis, that is benzene on treatment with the sulfuric acid, it will give sulfonic acid derivative, followed by treatment with the sodium hydroxide, then carbon dioxide, high pressure will give the salicylic acid. Salicylic acid on acetylation with the acetic anhydride will give aspirin. What are the uses of this aspirin? The main, it is used as an analgesic, that is pain relief, and it is also used as anti-inflammatory agent. Then mainly our topic, that is heart attack and stroke, it is used as an anti-platelet agent. So it is used to prevent the blood clots, reducing the risk of heart attack. And